As we take a look at Toronto, we have breaking news in Ontario. The province is reporting more than 9,000 new cases of COVID-19, shattering its previous record. Laura McQuillan is back with us for more on this. Laura, what can you tell us?
Yeah, John, if we had looked at a 9,000 odd number a couple of days ago, we would have said it was double the previous record. Yesterday, another record day at 5,700. So you can see that jump up by about 4,000 cases. But I've got to warn you, we need to be cautious when we look at numbers like this, because the case counts are likely not a true reflection of what things look like out in the real world in Ontario. That's in part because testing centres and the labs processing the testing are completely overloaded right now. If you go online, you try and book a test, you would be very lucky to try and to get one on your first go round. I've been hearing stories from people who need to get a COVID test that have been trying day after day, up to 7 days before they can even get that button to get that test. So it just gives you an idea of how much of a strain there is on the system and how much these numbers may not be an accurate reflection of the real picture right now. Now, earlier today, we did see Premier Doug Ford heading out to the International Centre in Mississauga. He was meeting healthcare workers there. They're going to be giving people their booster shots. He didn't take any questions from journalists while he was there, though there are certainly plenty of questions to the province right now about whether it should be implementing new measures ahead of people getting together for Christmas when we see these numbers climbing so dramatically. Another thing that we need to be watching closely in the days ahead is hospitalisation numbers, ICU admissions, and indeed deaths as well, because it does take a while for someone who gets sick with COVID to then get to the point where they need any kind of hospital care. We haven't yet seen today's hospital numbers or ICU admissions. We will bring those to you when we get them. But as those continue to climb, for instance, yesterday we saw the highest number since June in terms of hospitalizations, intensive care admissions, the highest since the end of September. We do expect to see those climb. It's just a matter, experts say, of getting an idea of how much more infectious or indeed dangerous this Omicron variant is. And we should know sometime in January, really a reflection of how bad things get as a result of any gatherings around the festive season.
Thanks for this, Laura.
You're welcome.